Hi honeys, how are you? Tanya Shiloh here, and of course welcome back to my YouTube channel. What's popping, what's well, and of course all that kind of good stuff over there. If this is your first time here, of course I'm 20-year-old in days making 21, and of course I do videos about makeup, glam, fashion, beauty, and of course my medical career. But of course on top of that, it has been a thrill kind of moment the last few days, 6 to 7 days. I'm not very certain. These are the days that have been on tool attachment, community attachment. Those people, of course, who have been watching the video, thank you very much for motivating me, and of course for all the nice comments, and of course all the beautiful feedback, of course, I've got throughout the whole videos. I think there is one video that you guys loved most. I'm gonna be putting it up here on the screen. But if you are new here, of course, consider subscribing. I'll just give you your time, please. Consider subscribing, and of course comment in the comment section below #new. It would make a very big difference. So without any further ado, let's just dive into the video right now. You guys, I know you have been like community nursing, community attachment. I know that most of the biggest population on my channel, it's not related to nursing, I guess. Yes, it's not related yet to my medical career. So I have a lot of new subscribers that literally I wanted, of course, to come over here to tell you a little bit more about, of course, community nursing, and of course or community attachment in general, because those are the videos that I've been posting recently that have been driving a little bit more of subscribers to my channel, and of course my makeup kind of sessions I do. So community nursing, it comes from, of course, first of all, nursing itself, it means providing health care, and this health care is provided by individuals, of course, who are devoted with love, and of course with ethics, but of course at the same time they have to be, of course, educated in terms of career wise, so that what they are doing, it is, of course, having an educational kind of a background, if that makes sense. So community, it's a group of people living like three, or not even three, but why am I saying three? But it's a group of people, of course, living within, I think, 500, 300, 100 kind of people living together socially, economically, and of course they can literally interact with each other in terms of their kind of businesses, their social ethics, and of course their kind of political ethics. So we have been on this 7-day trip with my fellow nurses, or my fellow sisters, to the different communities around my area, or around my place, around the parts of Kampala, and not only Kampala, to also some districts in Uganda, exploring the area, trying to find out how the health in those different communities is being improved, and how the health in those different communities, of course, is being, of course, brought to board through, of course, the different construction of hospitals, and of course health centers, and at the same time their sanitation, their environmental sanitation, personal hygiene, and of course all that. So another thing that literally prompted us to be entering into the community, it is also to finding out the different socio-economical kind of interaction of the people themselves with the different kind of businesses, or the main economic enterprises in those areas, such as we visited the abattoir, where we saw its importance to the community through providing the different opportunities to the different people around the abattoir. Abattoir means the slaughterhouse. We visited one day market, where we also saw the importance and how favorite is it, of course, right now to be in presence for the community, and of course all that. We also visited a lot of places, whatever the case may be, but at the end of all this was finding out how everything is being held with, or dealt with, socio-economically for the people, and of course for the business owners, and that at the same time, in the same context, keeping health at the first forefront, because girl, health first. Because another important point that I've not literally talked about is the communities, or communities, yes, I think that's the right English, but communities most of the time there is this thing of health. People are talking or already talking about health, such as we visited recently. If you have not watched the video, how dare you? I'm gonna be leaving it up here. Go watch it. We visited one of the slums, of course, around Kampala, and it was so heart feeling to find that people really do live in such conditions with very poor water supplies, living in waste or excreta, if I have tried to put it right, but living in all that stuff, yes, that you have understood, living in all that stuff, excreta and whatever the case may be, and having flooded houses whenever it rains, and all that excreta entering into their homes. It really portrays a very bad image of health. And of course, finding out that they don't have the different health facilities that have to be, of course, put in place for them to try to improve at the same time their health when they are sick, was also very heartbreaking. But at the end of the day, we were able, of course, to also write reports to the Ministry of Health if God helps and those people respond, because that's also another issue. But it's also very important that we as people who of course in very different areas with such other people who are in slums, we always advise them on what to do, and of course all that, collecting their wastes, and of course all that. So another point that I find very important that took us around to the community attachment or community nursing was finding out the different processes that these different economic enterprises in the community are using to make water safe, and of course proper waste disposal or management. I think that's the right English, proper waste kind of management, and of course the different processes these different enterprises are using in order not to harm the health of the people, but at the same time promote health. So for example, we visited the abattoirs, I've already told you, and they showed us, they passed through the whole process of slaughtering animals, and of course all that to make it very safe for people to consume in the form of meat. We visited, of course, Bugolobi sewage treatment plant. Of course, we saw how the process is done before the water is exchanged back into the lake. And also we visited different places, like they were so different. I think we had a total of around if not 9, 10, something like that kind of areas we visited, of course, to find out the health and of course all that I've told you about. And to summarize up the different reasons why we went for community attachment or community nursing, it was basically health. It was about issues of health, to find the right promptions, to find the right reasons why we are studying this course, and to be motivated at the same time that literally the people we are going to be working with in the different wards come from different backgrounds, come from different societies, come from different communities where everything is so different, and of course the health of things that they have to be participating with or they have to be interacting with is not literally done. So it was to open up our eyes at the same time as student nurses before we go to the ward, to know that we are going to be dealing with very different people. So very much, and let me grab you in my next video. If you have enjoyed the video, remember to give it a like, comment something in the comment section below, and of course remember that smartness, elegancy, and of course exploring a precious mind in 2020 remains our title. And bye for now.